This is CBC Here and Now.
We put in measures at the store as well to make an appointment instead of people coming in. So we just don't know who has the virus in our community right now.
Well, tonight, how Innu communities in Labrador are dealing with a spike of COVID-19. It's the first time they've seen positive cases during the pandemic.
The new surge in cases, restrictions and cold temperatures. How vulnerable people in the province are impacted, that's coming up.
It's been an active start to January. Another system's going to move in, this one bringing another warm-up.
Good evening and welcome to Here and Now. I'm Carolyn Stokes. There's a jump today in the number of people who are in hospital in this province because of COVID-19. So let's bring in Here and Now's Peter Cowan for a closer look at this change. So Peter, what are we seeing today?
Well, Carolyn, we know that hospitalizations tend to lag infections by about 2 weeks. And so healthcare officials had warned that we were likely going to see more hospitalizations just based on the sheer volume of cases that we've been seeing over the last week or two. And that's what we're seeing today. Let's take a look at the numbers. When it comes to hospitalizations, there are 2 more people in hospital, bringing that number to 3. The province also announced another 479 new cases. Keep in mind that may not be the complete picture since tests are backlogged and they are not testing everyone who they think might have the virus anymore. Of the new cases, 288 are in Eastern. The other hotspot, Labrador Grenfell Health, with almost 100 cases. And then there are 30 in Central, 56 in Western. Right now, there are 36 known active cases in the province right now. With those delays in getting tests run, the province's decision to test fewer people, these numbers are starting to become a less reliable indicator than we've been able to rely on through the last part of the pandemic. Today, one of the indicators to look at, how many tests are positive? 13% of those tests were positive, higher than it's been through most of the rest of the pandemic. So one of the big pushes from public health right now is to get booster shots into people's arms, and vaccine clinics were a busy spot today, like this one. They were initially targeting people over 70, but things were a bit slow this morning, so they opened it up to anyone over the age of 30. As health authorities free up more healthcare workers, they've been adding extra clinics and making more appointments available for booking. The province says more than 100,000 people have now received their booster shot, which is about a quarter of the population of the people who got those 2 doses. Now, as our knowledge of the pandemic continues to change and the strategy has changed around trying to do containment, well, what should we be looking for? We'll talk to an expert in viruses coming up a little later on the show. Reporting live from St. John's, I'm Peter Cowan for Here and Now.
As Peter just reported, nearly 100 new cases for the Labrador Grenfell Health region, a major concern for Labrador's Innu communities, where case numbers there continue to climb. One Sheshatshiu resident believes there's more the province could be doing. Here and Now's Reagan Burden has more.
Xavier Panashaway says it's always been the case that those living in Labrador receive inadequate healthcare services. With COVID-19 hitting Labrador hard, he's put those concerns to paper in a letter addressed to Premier Fury and other members of government.
It seems like we're not getting any help from the provincial government in Labrador. We're left by ourselves, right? And so it's a bit concerning, I guess, to a lot of communities, especially the ones up north.
Panashaway wants food, baby formula, diapers, and ventilators sent to Labrador's northern communities, and an increase of healthcare professionals on the ground. He doesn't believe the communities here are equipped to care for those with severe COVID-19 symptoms. And he says the answer? To send in the military.
Help would be very great for them, and to ease them from worries of being overwhelmed with work and being overwhelmed with the workload, right?
Panashaway sent his letter on December 30th and has yet to receive a response. Sheshatshiu confirmed its first COVID-19 cases just under a week ago, and Natwashish yesterday. Sheshatshiu currently has over a dozen active cases, 30 in Natwashish.
We have a diabetic people here in our community, and that's one of the things that we are very worried about. Of course, the elderly people that we are very, concerned about, and people for people who doesn't get vaccinated yet. So there's a whole range of things that needs to be addressed in our community.
Nui says the Band Council is working to provide whatever supports it can to community members.
We have a counselors that are on standby, to just in case if there is a youth or a young couple who needs to get stressed out, and just have our counselors be available when they are when they're needed. And also for people that are isolating, we try to provide some sort of support where we can shop for them and get their groceries for them while they're in isolation.
Mushwao Innu First Nation had already cut commercial travel into Natwashish. Now, more restrictions.
We put in measures at the store as well to make an appointment instead of people coming in. So we just don't know who has the virus in our community, right?
Nui says that everyone needs to stick together to beat this virus. The number of active cases in both of these communities is alarming to residents and leadership. And many are still waiting to receive their test results. Reagan Burden, CBC News, Happy Valley Goose Bay.
Some organizations that help lower income and homeless people have to scale back their operations under the new public health measures in the wake of the Omicron wave. Henrika Wilhelm has more on that.
Essential places in the province are still open under Alert Level 4, but for part of the population, some very essential places have been affected by the latest case surge.
Most recently, we've reduced our services back to an essential service model. So we don't have dine-in services anymore. We've had to suspend our guest empowerment programs. We've had to limit people inside the building, and we have to manage that very, very closely. And as well, there's things we can't do. We can't accept donations of food or for food or clothing right now, which our guests quite often rely upon.
2,000 people are registered here. About 3,000 meals are served every week. The 30-bed shelter is full most nights, and hundreds make use of programs every day. Service is important to many people.
It's really hard on the guests for us to be able to, or to have to, restrict the access the way that we've done that. But we understand that we had to provide a service that's safe, that doesn't compromise or provide any risk to not only our guests but also our volunteers and our staff.
The gathering place itself is also feeling the impact.
It's tough, it's really, really tough. We rely heavily on the support of individuals who provide financial support and assistance to us, so that's really important that able to continue. As the COVID levels increase, the ripple effect gets larger and gets more complex and more challenging. So it's important to us as an organization, it's important to volunteers and staff that we be able to continue to provide those basic services.
Davis says not everyone who comes to the gathering place is homeless. Some struggle to make ends meet.
We also have guests that come here who rely on part-time work. So we have many who work in restaurants or those types of service industries that have now lost that little bit of employment that they've had. So therefore, their reliance on the gathering place in our programs and services has increased and become more necessary for them as well.
Paul Davis says the community support during the pandemic has been great, but donations and services will be more and more impacted the longer restrictions exist. Henrika Wilhelm, CBC News, St. John's.
I'm Colleen Connors at the Cross Country Ski Club in Corner Brook, where there's very little mention of COVID-19.
All you hear is what you can't do. The beauty of with Blow Me Down, we're trying to tell you what you can do.
You could call this a little break, a piece from all that's going on in the world right now. We'll talk to some skiers.
We saw a little bit of a break in the weather today, depending on where you were. A few snow squalls developed earlier today for the Burin, parts of the Avalon Peninsula as well. But otherwise, not a whole lot going on. Let's take a look at what's going on out there as far as systems go. Under a ridge of high pressure at the moment, with some cold temperatures up across parts of Labrador, in the minus single digits across the island as well. We're keeping an eye on the next weather maker. It is an active, quite active pattern. We're going to watch this one roll through as as we head through the overnight and into tomorrow. And then that will move off. Anything north of this system will fall as snow. Anything to the south will be rain. A little bit of a break as we head through Friday, and then the next one moves in. This one heading a little bit further east, which means we could see some significant snow for parts of the island. I'll get into the full details when I come back.
Thanks, Ashley. Well, it was a scary start to the new year for one 5-year-old and his family at the Loop in St. John's. Sullivan Ryan was skating with his father and 14-year-old sister in Bannerman Park when some of the other skaters started to get rowdy. And in a flash, Sullivan's finger was severed. It's a story that Chrissy Holmes has been looking into, and she joins us now live in our newsroom. So, Chrissy, what more can you tell us about this?
Well, Carolyn, for the family, there are a lot of troubling questions that have emerged from this incident at the Loop on New Year's Day. The biggest, of course, being whether the 5-year-old's finger will heal. Right now, Sullivan Ryan is set to go back into surgery tomorrow morning. His mom, Kaylee Hogan, says she spoke with a surgeon yesterday. Sullivan is going to have to return to the Janeway to get his finger sewn on properly. But all things considered, Kaylee says Sullivan is doing very well. Now, for Kaylee, this whole situation started on Saturday, just after she received this, a video of her son. Kaylee says she was proud to see her son skating for the first time without an aid, but when she saw those other skaters whizzing by, she had a bad feeling, one that she communicated to Sullivan's father. They were actually just getting ready to leave when Sullivan's older sister, Bree, says the situation took a turn. I spoke with her and her mom. Here's part of our conversation about what happened.
Group of teenage boys, they come right behind me, and I can feel the wind of them going right past. And within a blink of an eye, I look, and they went right past Sully and my stepdad. And I see my stepdad, and he took off Sully's glove. And the first thing I see is him take his hand, pick him up, go to the bench. And in my brain, I'm nothing is okay right now. Like, I was screaming at the top of my lungs, telling them to stop, the group of teenage boys, or just everybody that was there, because it felt so helpless that you are experiencing your baby brother screaming in pain because his finger was just severed. But nobody's caring, nobody's stopping, everyone's carrying on. We were lucky enough to have a nurse stop with her daughter, and I think it was her husband. I'm not 100% sure, but they did stop and help us. She was tending to him, doing first aid. She asked for my stepdad's sock, and then was like holding his finger, applying pressure, and she was the nicest thing ever. She was comforting him, and her daughter took it on to comfort me because I was freaking out a lot. And that was a really big thing for the daughter to do.
I mean, sounds like there was a lot of people there. There was obviously this group of teenagers that skated over your little brother's finger. Like, nobody stopped? Until this nurse, nobody stopped?
They only stopped when they saw the paramedics take him to the ambulance. They didn't even stop when the ambulance was there.
How did that make you feel as his big sister?
Angry, and made me feel like I was just invisible. It was like I was screaming into a void. It's like you always hear people saying they feel like they're not heard, but when it's literal, something I'll never forget.
Well, Bree and Kaylee says a lot happened after that, including something unexpected. After they shared their story, a larger debate was sparked on social media, and of course, a lot was said in between all of that. Kaylee says in between the victim blaming and finger pointing, it's been frustrating. She says that she isn't being a buzzkill, but she wants everyone to be able to go to the Loop and have a good time. And in speaking with some other parents, she says there are concerns out there about safety and supervision at the Loop.
Oh, it is a city-ran facility that they do promote uniquely to families, seniors, even on their website. They have a little girl pushing a skating aid, so you would assume that it is a safe place, and at times it is, but most times it's not. Somebody was there saying, hey, go the right way, slow down, this is your first warning, second warning.
Yes, exactly.
We do have security on at the Loop. Our staff have asked the security if they can continue to keep an eye on the type of behavior that has been described on the loop, in order to keep it safe for everyone. So that we've had that discussion. So once we've had the conversation with the family, then we have further information. Then we can see what are the further steps we may have to take.
Mayor Breen says he'll be looking into whether there is video of that incident and, of course, into some of the other issues that Kaylee has raised. He says he's sending Sullivan and the whole family the very best. And for now, the family says they're just focused on 5-year-old Sullivan and hoping that the little boy will be able to keep his finger following tomorrow's surgery.
Thanks so much, Chrissy. That's Here and Now's Chrissy Holmes reporting live from the newsroom. Well, now to a close call we shared here on the show last month. In early December, police were looking to speak with the driver of this blue SUV who was caught on dash cam video driving very dangerously, narrowly avoiding a crash with 2 transport trucks. And if you saw this video back then, you'll definitely remember it. Such a close call. The SUV swerving in between 2 transport trucks on the highway on the province's west coast. Well, it seems police have found the driver. A 69-year-old man was ticketed for imprudent driving earlier this week, driving without due care and attention. The man was also ticketed for passing on the left while it was unsafe to do so. Well, there's one spot on the province's west coast where people can escape the stress of COVID-19, and that's on the Nordic ski trails at Blow Me Down Ski Club. Management says the trails have become a sanctuary, an escape for the everyday, and it seems everyone wants in. Here and Now's Colleen Connors reports.
Peace and quiet, fresh air and no wind, a whole lot of social distancing.
And we ski maybe 10 or 12 kilometers, and we have normally the same friends who come up and we chat, solve the problems of the world, and get some exercise, right?
Dozens of skiers head out on the 42 kilometers of trails on their lunch break. A chance to escape the COVID briefings, the stores, the newest variant.
It's like a sanctuary here. And really, the people that work here, it's like a family. So you come up, for example, today I forgot my boots, first day out, so I went in, they just gave me a boot. So it's much like a family environment here, and it's just away from, as you said, all the COVID things that are happening around us.
So much of a break, staff here say membership is way up from 600 members to 900 this winter. While level 4 means there is limitations inside the lodge, there's only freedom on the groomed trails.
You know, just with the equipment, skis and poles, you basically already got 6 feet of social distancing already accomplished just by putting your gear on.
Lehman believes membership is up and growing because cross-country skiing allows for a major escape, some normalcy, and of course, exercise.
Well, everyone is troubled with all the things happening in the world and COVID and all of this, and all you hear is what you can't do. The beauty of with Blow Me Down, we're trying to tell you what you can do.
Lehman says there's room for more membership, and anyone who signs up now will get a free ski lesson. And night skiing should start soon, when more snow falls. Colleen Connors, CBC News, Corner Brook.
Another active weather day tomorrow. Some of us are going to need snow shovels, some of us are going to need rain boots, and I'll break all of that down for you coming up after the break.
This weather update is brought to you by the NL 511 app. Know before you go. Check road conditions, highway cameras, and the provincial plow tracker with the NL 511 app.
Ashley's here now with a look at the weather forecast, and a stormy day yesterday, but a beautiful winter's day today.
Yeah, it was a great day yesterday to stay inside and today to enjoy the snow that fell, certainly on the Avalon. Temperatures pretty nice into the minus single digits, but that lack of wind felt pretty nice out there at times as well. Let's take a look at the temperatures across the board, hovering around -2 in St. John's, and those temperatures pretty much the same across the board, except -20s for Labrador, Makkovik at around -21. For the day, and -23 in Lab City. And the temperatures that you're seeing right now on the island anyway will be the daytime lows or the overnight lows tonight, because temperatures are going to climb, and that's as our next system rolls through. Anywhere south of the northern peninsula is where we're going to see those temperatures warming up. But another cold night for Labrador as well. Current wind chill sitting at about -31. So that next system is already prompting warnings, wind warnings for the eastern half of the island essentially, and then rainfall warnings for the west, except for the northern peninsula where you are under a snowfall warning or a winter storm warning. In southeastern Labrador, you're seeing those snowfall warnings as well. So here's your temperatures. This is what I was talking about. Now this is what the temperatures will climb to as we get through the morning hours, and the winds are going to ramp up. They'll be out of the southwest between 30 to 50 kilometers per hour, but exposed areas on the coast, we'll see those gusts upwards of 70, maybe even 80 kilometers per hour, even towards eastern Newfoundland as well. But again, another cold night for Labrador, -34 for Lab City tonight. Relatively light winds, but the wind chills will be cold tonight again, into the -30s, even -40s as we head through tomorrow morning. Now, as far as the timing for this system goes, kept the winds on there for you as well. This will we'll likely see some snow for the west coast, some flurries or light snow tonight, and then that will quickly change over to rain. And this is when those winds are going to ramp up as the system edges a little bit closer as well. So as we see that transition to rain, that's when the winds will really pick up, gusting, like I said, 70 to 90 kilometers per hour in the exposed areas. Some areas, for example, Burgeo is showing about 100 kilometers per hour, but there's that line I was talking about, northern peninsula. You're likely going to see all rain with this one, and anything south of that will see, or rather all snow, anything south of that will be rain as we get through the day. Now, the heavier rain will continue to track further east through the day tomorrow by afternoon anyway, and then further east for the Avalon into the late afternoon, early evening hours is when we'll see some of that heavier rain. But again, windy conditions through most of tomorrow. Now, as that area of low pressure continues to track further north and east, in behind that, those winds will shift. So the showers or rain that you're going to see on the west coast is going to change back over to snow. And then by after midnight tomorrow night, that will be said and done, and the winds will finally ease as well. As far as snowfall amounts go, again, northern peninsula is where we'll see the most amount of snow. I'll just zoom in a little bit there. Some of the models showing 60 to 70 centimeters. However, some of that, depending on the track, may fall as rain at times through the afternoon. So you're looking at closer to 30 to 40 centimeters is a good bet in those areas for parts of the northern peninsula. And then rainfall amounts, this is what you're looking at. Some areas showing in excess of 40 or even 50 millimeters. That will likely be in the higher elevations, but it will definitely be a very rainy day tomorrow. Temperatures, of course, mild, 7 to 8 degrees. You're looking at the temperatures dropping though, with those winds shifting to the northwest on the west coast. So 6 degrees to start, dropping down to about 0 degrees into the afternoon for you in Corner Brook, and then quiet for the rest of Labrador. You're looking at sunshine and about -25 for Lab City. Let's look at the forecast. We'll look ahead with the next system when I come back.
Thanks, Ashley. Well, an update now on a story we brought you last night.
This has been a really long struggle for us. It took us 20 months initially to even be seen by the fertility clinic, and I know that's of no fault of their own.
Stephanie Regular's fertility treatment has been put on hold. Eastern Health says the pandemic has impacted other patients. There have been periods when the fertility services clinic was closed. Eastern Health says it's working with the clinic to determine which fertility services can continue and will be in touch with patients. The statement says Eastern Health understands and appreciates how difficult this is and assures patients it will resume services as quickly as possible. The community of Natwashish in northern Labrador is seeing its first surge of COVID cases. 30 positive cases were reported yesterday in a community of just under 1,000 residents. Joining me now for an update on this situation is Chief of the Mushuwa Innu First Nation, John Newey. Thank you so much for being here.
You're welcome. Thank you.
So let's start with the numbers. Has there been any change in the number of positive or presumptive positive cases since yesterday?
No, we have been, like I said, we've been reported, updated by our medical staff team here in Natwashish. And the number they gave us was positive 30 of here in Natoshish. But with the number of contact tracing that we have, they told us to expect more in coming days.
Can you give us a sense of the age range of the positive cases?
It ranges from a 2-year-old to probably 55.
Is there concern about the vulnerability of the population there? A 2-year-old doesn't have the added protection of a vaccination, but are there other pockets of the community that you're worried about?
There's a lot of things to be worried about here in Natoshish. We have a diabetic people here in our community, and that's one of the things that we are very worried about. Of course, the elderly couple, the elderly people that we are very concerned about, and people for people who doesn't get vaccinated yet. So there's a whole range of things that needs to be addressed in our community.
Do you know how much of the population has been vaccinated?
The last time I know, I was told the first dose was close to 100%, and the other one was probably around 60 to 80%. So the third shots, it's in the process right now as we speak. Right now, we have a counselors that are on standby, to just in case if there is a youth that who needs to get stressed out, and just have our counselors be available when they are when they're needed. And also for people that are isolating, we try to provide some sort of a support where we can shop for them and get their groceries for them while they're in isolation. A lot of people have been stranded in their home, staying in their homes, due to because of the contact tracing, and they're very anxious to get out and enjoy fresh air, and so we try to provide those that insurance. Everything is going to be okay if we stick together and work together.
What kind of measures and restrictions have been put in place to contain this outbreak?
We have been suspended all commercial flights to Natoshish from Goose Bay and all the coastal communities due to an outbreak. And we only accept freighters, scatterbags, and medevacs that's coming in. Of course, we allow people to go back out, but they know that they can come back in such a long time. And also that we put in measures at the store as well to make an appointment instead of people coming in. So we just don't know who has the virus in our community, right?
And what about the community's health clinic? Is there healthcare staff available right now? Do you need additional resources? How's your supply situation looking?
Of course, it's always beneficial for us, to get more help. We had a public health nurse here, and there should be another one coming in tomorrow and another one on Friday. So we have 3 public health nurses from our side, and the nurses at the LGH were providing the service while everybody was trying to get back to our community.
So lots of people isolating in your community. Some of them are probably watching right now. Is there anything that you'd like to say to your community right now? Any kind of message you would like them to hear from you?
Yes, I have been updating the community over past since December 25, right up to yesterday. So I'd like for them to continue to stay isolated in their homes and wait for their results to come back, because we all need to stick together and work together to beat this virus. If we work together, we can do this, and I believe we can do it.
Well, Chief John Newey, good luck with it, and thank you so much for this update.
No, thank you, and happy holidays.
Well, to some national news now. The Prime Minister has made his first appearance of the new year. Justin Trudeau took part in a news conference today with health officials urging everyone to keep their guard up. And he made a special appeal to anyone who remains unvaccinated.
It's never too late to do the right thing. It's never too late to go and get your first dose of vaccine. I can tell you that that frontline health worker who's giving you your first dose of the vaccine, even now in January 2022, will be immensely pleased to be able to give you that first dose of vaccine even today, because they'd much rather be giving you an injection of vaccine than intubating you in an ICU.
The federal government will quadruple its contribution of rapid tests to the provinces and territories this month. Trudeau says as long as we keep doing our part to keep each other safe, we'll be looking at a better spring.
With word that most people in Newfoundland and Labrador may end up getting COVID-19, we wanted to get the perspective of an expert in viruses.
It's hard for people to hear that, but I totally agree with Dr. Fitzgerald that is what we're facing now.
Rod Russell shares his perspective on the new strategy coming up. This week has marked a turning point in how Newfoundland and Labrador combats COVID-19 At a briefing on Monday, the Chief Medical Officer of Health, Dr. Janice Fitzgerald, said it's now looking likely that COVID is going to hit a lot more people.
The reality of this virus is that it's so infectious, most people will acquire it, but our healthcare system cannot withstand the pressure of everyone acquiring it at the same time.
So what does that mean for living with COVID-19? We want to get the perspective of a virologist. So Rod Russell is here to join us. He is a professor at Memorial University. Thanks for joining us.
Thanks for having me on, Peter.
What was your reaction when you heard those comments from Dr. Fitzgerald?
My reaction was surprised. I wasn't expecting her to say that at this point, but at the same time, in a way, I was relieved because that's sort of how I've been feeling for a long time. I felt that we were all going to get infected with Delta, to be honest, because Delta seemed to be settling down into this sort of stable situation, and it's going to keep mutating and keep making minor changes, but you don't normally expect big changes after that. So I figured since people who were double vaccinated were still getting infected with Delta, I figured, okay, it's just a matter of time. Immunity wanes after the vaccinations, and we would all get infected at some point, but hopefully have mild symptoms because of our vaccines. So when Omicron showed up, I figured, okay, it's the same situation. We are all going to get infected with Omicron, but it's going to be a much shorter time frame. With Delta, I figured over the next couple of years we'd all get it. With Omicron, it could be the next couple of months. So I think it's hard for people to hear that, but I totally agree with Dr. Fitzgerald that is what we're facing now.
There are a lot of people who now are kind of frustrated because they feel like, okay, I went out and I got my vaccine and this was supposed to prevent me from getting it. Does this mean the vaccines have failed?
No, and that's the thing. See, it's been hard, right? These vaccines came out fast, and then it wasn't clear, what their effect would be. But these vaccines, we know that they aren't that great at keeping you from getting infected, and that's the point, right? The best I heard through the whole 2 years we've been dealing with this now was about a 50% chance of decreasing or chance of keeping you from getting infected. And you have to remember, right? There's getting infected, and then there's getting sick. The vaccines are good at keeping you from getting sick. They're not great at keeping you from getting infected. And from a public health point of view, the goal is to keep people from getting sick. If we have a virus that infects everyone but doesn't make people that sick, that's not really a problem, or not a problem for most people. Of course, it's a problem for some, and those people are going to have to be more careful for the whole time. But it definitely doesn't mean the vaccines are failing, because the vaccines are doing what they claim to do really well. And if you look at the data, the dashboards that I watch show cases versus deaths. And what's really different now compared to previous waves is the cases are higher now than they've ever been in most parts of the world, but the death rates, and I believe they're going to stay that way, the death rates aren't catching up.
What about this idea that I've heard from some people who are kind of feeling like, okay, well, if we're all going to get it, then why do we need these restrictions? Why can't we just sort of, we've got very few people in hospital, just let the virus run its course, better get it over and done with, rather than facing more restrictions and more shutdowns?
We saw, Mr. Diamond in the last briefing say that I think it was 500 or 600 healthcare workers are already isolating due to exposures or infection. This is the point, right? If we have everybody get infected at the same time, society is going to stop, right? Nobody's going to be able to go to work. Teachers won't be able to teach. Healthcare workers won't be able to work. None of us will be able to work because we'll all be hiding or isolating or actually dealing with infection. So I believe that right now, I agree that with Dr. Fitzgerald that we can't really keep up with this variant. It takes time to trace. It takes time to book a test. It takes time to get a test and then get a result.
One of the things that they are doing when you talked about testing there is, the testing system is overwhelmed right now, so they're stopping testing for people who are symptomatic and close contacts. They're just going to assume that they probably have COVID and treat them accordingly. So that means our testing numbers, which we've been watching those daily numbers for almost 2 years now, they're getting a lot less reliable. What numbers are you going to be looking at over the next, couple of weeks or so to get a good handle on whether or not, how this province is handling Omicron?
Hospitalization. In my opinion, it's all about hospitalization now. The cases as you said, right, if we're not testing the same as we were, we're not going to know the true numbers of cases. Even if we were testing, I'm not sure we would know the true numbers of cases, because some people are having really mild cases. People with their boosters already a while ago are having, some of them are having really mild infections where they may not have even thought that they had COVID, may not have bothered to get tested. I think most people are getting tested at this point because some are getting tested because they have symptoms, but some are getting tested because they were told they were a contact or a contact of a contact. So I think we were already, in my opinion, we were already missing a lot of cases because of the mildness of the symptoms for people who've been vaccinated thoroughly. So I believe the hospitalizations now are the key. And that's really, we want to get to a place where there's just not that many people getting sick. And if this variant is milder, it's not as severe, and it's looking like it might be the case, then it's the hospitalizations that are going to be important to watch.
Well, we'll keep an eye on those numbers. Rod Russell, thanks for joining us.
My pleasure. Thanks for having me on.
Well, more children are ending up in hospital because of COVID-19. Doctors in the U.S. are admitting over 500 children a day. Here in Canada, admissions are also rising as pediatric hospitals see a disturbing new trend: more infants with COVID-19. Christine Birak reports.
Inside the Children's Hospital of Eastern Ontario, doctors are seeing a small wave of new patients.
Since the holidays, we've had numerous infants who've been admitted with COVID, and all of whom had mothers who were completely unvaccinated.
Pediatric cases are still rare in Canada, but just days into this new year, the U.S. CDC says roughly 600 children with COVID-19 are being admitted to hospitals daily, including 4-month-old Grayson Perry, who's clearly struggling to breathe. His mother worries he may need to be intubated.
It's just really scary. So I just hope that, he's able to get better.
She thinks he caught the virus at a family Christmas gathering. Grayson's one of nearly 70 children now hospitalized at Texas Children's. Doctors say it's a record high for America's largest pediatric hospital.
The problem is that with so many children and adults infected, even if the percent hospitalization rate is lower, we could see more children hospitalized.
Canada's largest children's hospital had fewer than 5 patients with COVID-19 a month ago. Now, that number is 12. Sick Kids Hospital says, in general, patients are experiencing mild illness with symptoms such as fever and dehydration. Doctors are encouraging everyone who's eligible to get vaccinated, especially those who are pregnant.
We know that vaccination during pregnancy allows for a passive transfer of antibodies produced by mom across the placenta to the baby, and that these antibodies, we expect, do help protect baby during those first few weeks of life when they might be most vulnerable.
He adds, repeated studies have shown COVID vaccines are safe during pregnancy. As for vaccines for children under 5, they're still in the works, but Moderna says it's hoping to have results from its pediatric trial by the end of the month. Christine Birak, CBC News, Toronto.
With PPE litter skyrocketing during the pandemic, a Montreal man decided to take matters into his own hands, literally. About a year ago, he embarked on a mission to pick up every disposable mask he saw on the ground. He's picked up a whopping 50,000 so far, averaging about 140 masks per day, but his daily record more than 400. He hopes to inspire people to be more careful when throwing away masks. Prince Andrew's legal team is pushing for a lawsuit against him to be dismissed. It alleges that in 2001, the prince sexually assaulted a 17-year-old American teen. But the U.S. judge didn't make a ruling on whether the case should be tossed. Freelance reporter William Denslow has the details from outside the New York court.
At this hearing, Prince Andrew's legal team laid out several reasons for why they think this civil case against their client should be dismissed. They say there's a constitutionality component, saying that this civil case was not presented in a timely manner. They also say that there haven't been enough details presented about this alleged sexual assault case. Virginia Giuffre alleges that she was sexually assaulted by Prince Andrew when she was 17 years old at properties owned by both Ghislaine Maxwell and the late financier Jeffrey Epstein. However, the judge Lewis Kaplan said in this hearing that there's no obligation to provide further details relating to this alleged assault at this time and place. There's also, of course, a key topic that was debated fiercely during this hearing in New York was that of a 2009 settlement between Virginia Giuffre and Jeffrey Epstein. Virginia Giuffre alleges she was sex trafficked by Jeffrey Epstein as a teenager, but there was a settlement between the two back in 2009 that was made public on Monday. As part of that settlement, Virginia Giuffre was awarded $500,000, but there was also an agreement not to sue anyone that could be seen as a potential defendant. Prince Andrew's legal team and Andrew Brettler, his legal representative, say that shields him from liability. Virginia Giuffre's legal team say it doesn't, saying that it's an irrelevant settlement and that he couldn't have been a potential defendant back in 2009 and he wasn't subject to Florida jurisdiction where that settlement was reached. Now, Judge Lewis Kaplan says he'll make a ruling on whether this case will go forward pretty soon. William Denslow for CBC News, New York.
Well, in other news, Venice is about to become a more exclusive tourist destination. The famous city of canals is going to start charging admission. As many as 80,000 tourists visit the city each day, causing congestion. Admission will be about €5 or $7 Canadian for a one-day pass, and you'll have to book in advance. Police can monitor crowds using cameras and cell phone data. The measures are not related to COVID.
As we look towards the end of the week, after tomorrow, we're actually going to see those temperatures drop by the time we get to Friday, and likely some of that precipitation will end as flurries and then eventually off altogether into the afternoon. Let's take a look at those temperatures on Friday, sitting in the minus single digits, -2 for St. John's. For the rest of Central, you're looking at your temperatures in and around -4. Some cooler air, though, still for the Northern Peninsula. And then same thing across Labrador. Beautiful day as far as sunshine goes, but it will be quite cold. Happy Valley Goose Bay going to hover around -19. Now, we are going to see the next system move in Friday evening into Saturday, it looks like at this point, and Central and West Coast, as well as Southern Newfoundland, likely going to see lots of snow with this one. And for eastern areas, potential to see that changeover, again, depending on the track. We could see a changeover in the afternoon on Saturday, but as the system moves, we get back into that onshore flow, or at least more northerly flow, and things will change back to snow again on Saturday. Definitely one to watch. We'll likely see a few warnings with this one, but temperatures will be below 0 for most of the island, except again eastern areas where temperatures will rise to the single digits, likely low single digits, not quite as warm as we're going to see tomorrow. But then the sunshine continuing for Labrador again, and continuing to hang on to those cool temperatures as well through the afternoon. Now, after that, another warm up, it looks like on Monday, definitely a roller coaster in every way, up and down. So we're looking at the chance of some showers again, and then changing back over to snow as those temperatures dip Monday evening back down below 0. And then for central Newfoundland, you're looking at a similar warm up on Monday, maybe not quite as warm for western Newfoundland, going to keep you in the flurries at this point, or some light snow. And then for Labrador, the eastern portion still going to see that potential for some snow both Sunday and Monday. sunshine until you get there. And then things will start to get a little bit unsettled for Western Labrador as well by the end of the weekend, beginning of next week. Temperatures a little bit warmer on Sunday into the minus teens, but back down to the minus 20s by the time we get to Monday. Speaking of the big land, I just wanted to share this photo. In Nain, Madeline sent that great shot in. This is the sun just before sunrise. If you have any weather photos that you would like to share with us, send them to nlphotos@cbc.ca.
Oh, that is beautiful, beautiful, clear skies there in Nain. Thanks so much for that picture, and thank you, Ashley. And of course, we'll be following all of the news coming out of Nain and other parts of the north coast in the coming days as we're seeing cases of COVID-19 continue to rise in those areas and the rest of the big land. But for now, thank you so much for joining us. We appreciate you spending part of your evening with us, and we hope you can join us again tomorrow night. Good night.